Welcome to Chapter 11. This chapter is on physical disabilities, health impairments, and attention deficit hyperactivity disorder. There's a huge amount of information in this chapter, and so we're going to start with the definition of the idea definition of a physical disability, and there's two subsets here. The first is orthopedic impairments. This has anything to do with your bones, your joints, or your limbs, or any type of disability relating to the central nervous system that impacts your movement. Now remember, we have to say that it also affects your educational performance, and you'll need special education because of these impairments. The other thing to think about is the category of other health impairments. This is a wide variety of possible conditions that limits the strength or vitality of the person. These things could include conditions such as cancer, asthma, hemophilia, leukemia, diabetes, heart conditions, and so forth. This is a very diverse group, extremely varied, because physical problems can vary from mild, moderate, or severe, and some people can have a single disability area and others could have multiple disabilities. Also, the degree of disability might vary over time. The individual may not have any impact, as a 4-year-old, let's say, and then by the time they're 7, we start to see impairment. Children with physical needs may need adaptations in the classroom. They might need different teaching strategies. They might need assistive technology and health services. So all of these things might be involved on the IEP. Now, a person might receive services under a different category as well. So, perhaps if they have ADHD, they might be getting help under the emotional disability category. Some people do not require specialized services at all because it doesn't impact education. For example, if you had asthma, that may not be severe enough to warrant an IEP. The number of students getting services has increased. Generally, these are for chronic conditions. Those are conditions that are more long-term versus acute conditions such as something that's severe but very short-term. A couple of other terms I'd like you to look at are the terms that end in plegia. For example, hemiplegia means half of the body, and that is like drawing a line from the top of your head straight down your legs, right down the middle of the body. Maybe you know someone who has one side affected, maybe from a stroke. Quadriplegia means all 4 limbs are affected, and paraplegia means only the legs are affected. Let's take a look at some of the different disability areas. This list is by no means exhaustive, but this is a long chapter, and there are many different physical disabilities that are discussed. The first one is cerebral palsy. This one is the most prevalent physical disability in school-age children. It's due to a lesion in the brain or an abnormality of brain functioning or brain growth in utero. Many diseases can also affect the developing brain and lead to CP. Usually CP doesn't get worse as a child ages. It is not a disease, it's not contagious, and in most cases it's not inherited. This is not a curable situation, but we can help with physical therapy, maybe in some cases surgery, and ongoing work to maintain independence. It is a permanent disorder of voluntary movement and posture. And sometimes people think, oh, CP equals intellectual disability, but there really isn't any relationship there whatsoever. CP is classified according to muscle tone and motor movement. I have some terms listed here on your slide. I want to go to this term first, hypotonia. Hypo means over, so over relaxed or floppy muscles. There's very low muscle tone. This is especially apparent in infancy, and usually as a child develops after the first year of life, it moves into hypertonia, which is very extreme rigid muscles. In fact, hypertonic CP is the most common type of CP. You might see someone with a very tight fist having trouble picking things up. They might have a scissor walk where their knees are together and their toes are turned in. It's not uncommon for someone to have a deformity in the hip spine area. They might have contraction of muscles in hand, feet, and elbows. The next most common type, the second most common type, is the athetoid type, or athetosis. This is a person who doesn't have much control over their body movements. They might be making wild or large, big body movements when they're trying to pick up something small. They may have trouble controlling facial muscles, and there might be drooling apparent or facial grimacing. They may make irregular twisting motions. The third type is ataxic, and that is the least common of the three. Ataxic means that the individual has poor balance, may be very dizzy, and may even fall if not supported. They're unsteady on their feet. The next type of physical disability that we're going to cover is spina bifida. This is a congenital defect that in the vertebrae that enclose the spinal cord. This is what we would call a neural tube defect. This happens within the first 4 weeks of pregnancy when the baby is developing that spinal cord. It's a bulge, if you will, in the spinal cord. And there's 3 types that may occur. The first one is spina bifida occulta. That occult means hidden. That is the mildest form, where maybe only a few vertebrae are malformed. It's not visible outside of the back. And that is the least common. So the mildest type is the least common. The next kind is meningocele. Meningocele is when there's a bulging of that spinal cord through the opening in the infant's back, a small bulge out there that is coming out. And then finally, the myelomeningocele is the most common and the most severe and serious type. This is actually bulging out of the spinal lining. That cord and nerve roots protrude outside of the baby's back. When we have something like this, wherever the defect is on the spinal cord, we have resulting problems below. So the higher the injury area, the more impaired the person will be. So if the injury is occurring really low in the back, the person may be able to walk, may have trouble with bowel and bladder, but if it's occurring way up at the top by the neck, there might be paralysis all the way down the rest of the body. Also, a term that I would like you to know is hydrocephalic. So this is when spinal fluid can go up into and surround the brain area but not come back down. And so that's a very common condition with spina bifida, and that is treated with a shunt in the brain that then can help that spinal fluid drain down, and that tube goes down into the abdomen area and is excreted out through the body. There are other types of orthopedic impairments. One of them that you might have heard of is muscular dystrophy. This is a progressive weakening and degeneration of the muscles so that the muscles waste away. And of course your heart is a muscle, and so with that we don't have a cure, so your heart then will have atrophy and hardening, and this is a progressive degenerative illness that leads to death and related to heart failure. The Duchenne's muscular dystrophy is the most common and most severe type. It affects only boys. The voluntary muscles in these children become more useless over time. They're born without any seeming difficulty, but then, between the ages of 2 and 6, they have trouble running, climbing stairs, maybe falling more frequently, and the small muscles of the hands and fingers are affected the most. So, in other words, your muscle protein is being replaced by a connective tissue that's very taut and tight. Another type of orthopedic impairment is a spinal cord injury. You might have known someone who's had an injury related to a crash, a fall, an act of violence, or a sports injury. Boys more than girls are more at risk here for these kinds of injuries. Remember that the higher the injury on the spine, the more the injury cuts through that spinal cord, the greater the paralysis. Another health impairment that I would like you to pay attention to is seizure disorders. This is an area that you may come into contact with. Perhaps you know someone that does have a seizure disorder. I liken it to an electrical storm in the brain, like a thunderstorm or a power surge in a computer or an engine misfiring. This electrochemical activity of the brain causes loss of muscle control. It can happen in any stage of life, but most often starts in childhood. It can be caused by more than 50 different types of conditions. Chronic seizures are known as epilepsy or seizure disorder. There are different types, and I've listed some of them there on your slide. The first is generalized tonic-clonic seizures, which are the most obvious and the most serious. Here a person has stiff muscles, loss of consciousness, and may collapse to the ground. When they come out of the seizure, they might be confused, and that is a post-ictal state. Absence seizures, we used to call those petit mal seizures, are less severe and more frequent. They can occur 100 times per day. It is a very brief loss of consciousness, like a blank stare, fluttering of eyes. The person might be looking like they're daydreaming, but actually they're having a seizure. A complex partial seizure is also known as a psychomotor seizure, where the person has like very brief purposeless activity. They might shout, smack their lips, walk around aimlessly, pick at themselves, or run. They might look like they're sleepwalking, but that's actually seizure activity. And the final one is a simple partial seizure. They have a sudden jerking motion, perhaps in their arm or their leg. They don't lose consciousness, but they might have unusual smells, or they might smell things unusually, or taste things in their mouth, or have odd emotions that don't seem to fit during this. It might even move into a full generalized tonic-clonic seizure. Sometimes people have an aura, and I have that on your slide there. It's a warning sensation prior to a seizure. It might be some sort of change in perception, like they might see a halo, or they might have a certain ringing sound in their ears, or smell something, and that gives them a little warning. Seizures, the good news is, can be controlled by medication. Sometimes people stop taking their medicine. Usually they feel like they don't need to take it anymore, or perhaps they're worried about the cost, or maybe they don't like the side effects. That is the number one cause of seizures, is not taking the medication. The number two cause is not enough sleep. But there are many triggers to seizures. It could be, illness, it could be alcohol or substances, poor nutrition, stress, flickering lights. Women may be more prone to seizures during right before their menstrual cycle. And like I said, there are many types of causes of seizures, but you know what? For the most case, we do not know what causes a seizure. You don't know the cause. I would like you to review the first aid procedures. I've given you those in a handout in Blackboard. Another significant health impairment that we're hearing quite a bit about is diabetes. It's very, very common. 1 out of 600 people have diabetes, and that rate is going up. It's a chronic disorder of the metabolism, and your body is unable to break down sugar. So your IEP might need to have signs of hypoglycemia and signs of hyperglycemia. It'd be very important for an instructor to know what to do if you had low blood sugar or hypoglycemia. You could have faintness, blurred vision, drowsiness, nausea, dizziness, irritability. And then we would need to know what to do. Do you give a little glass of juice, or do you give a small bite-sized candy bar? What needs to happen there? Hyperglycemia is very high blood sugar. It's very serious, and usually that's a gradual onset, and it shows that your diabetes is not in good control. So really, when you're having high blood sugar, you have too little insulin present, and you can actually go into a diabetic coma. There is fatigue, hot skin, labored breathing, maybe a fruity smelling breath. So your IEP will need to say, how do we treat it? What kind of snacks are permissible? What type of exercise should the student do? Do they need to take snacks during the day? You know, how do we manage blood sugars, and how do we treat any of these conditions? Another significant health impairment is asthma. Asthma, you know, is the most common lung disease in children. You know, it can, you know, may run in families. There's heredity and environmental factors. Asthma is the leading cause of absenteeism in schools, and it is a chronic lung disease resulting in narrowing of airways. Asthma, good thing, can be controlled with medications and selection of activities, and also managing triggers and so forth. Another health impairment that I'd like you to read about is cystic fibrosis. This is a genetic disorder that affects the lungs and digestive system of the individual. Here the person has difficulty breathing because their body produces a lot of thick mucus that blocks the lungs and functioning of breathing, and it may cause decreased growth and malnutrition because you cannot digest things. So this is a person who has to take an inordinate amount of calories to maintain their weight and growth. They need to possibly wear a weighted vest that is electronic that thumps their chest to dislodge mucus. They may be on quite a few medications. These are children that used to die early, usually by the age of 8. But now with good medical care and advancements, these are individuals that are living into their 30s and 40s. Another area that I would like you to read about is acquired immune deficiency syndrome, or AIDS. Here the person has difficulty fighting off infections. It's a breakdown of the immune system functioning, and so these children are afforded protection under the law, you know, for confidentiality, and what we need to know is that we would want to use universal precautions to help everyone. So hand washing, you know, watching out for the body fluids, wearing gloves, and so forth. I'd like to turn our attention to attention deficit hyperactivity disorder. Again, you could spend your life studying this particular concern, but what I want to do is just give a brief overview in this chapter. The essential feature is problems with inattention and hyperactivity and impulsivity. Children with ADHD can be served under the other health impairment category because it limits your alertness to the environment, but it can also be served under the other category of emotional disturbance learning disabilities. The prevalence ranges from 3 to 7% of school-age children. Well, we really don't know what causes ADHD, and research is pointing to a neurological problem. We know that it can run in families. There are genetic factors probably going on, but we know that it doesn't result from poor parenting or food allergies or excess sugar. This is the most commonly diagnosed psychiatric disorder in children and teens. And it's important for you to know that about 2/3 or about 66% of people will continue to have ADHD symptoms into adulthood. And we will diagnose this by looking at various behaviors. The thing that's difficult here is that this individual may have other disabilities. They might have an intellectual disability, they might have learning disability, they may have autism or any combination thereof of any of these disabilities. So sometimes we have trouble figuring out what exactly it is. Now, your textbook talks a lot about children, so I wanted to point out that I've given you information about adult ADHD on this web link as well, because I think it's very important for you. So what are the symptoms of hyperactivity? Well, fidgeting, unable to sit still in a seat, running, climbing excessively, playing might be difficult for them to do something quietly. I like the description of always acting as if they are driven by a motor. Now, I know some of you probably, once you've had too much coffee or other caffeinated beverages, you might feel you're driven by a motor. Sometimes that doesn't feel so good. This is someone who cannot turn it off. So it's very, very uncomfortable to feel like they always need to be moving. They may talk excessively. Symptoms of inattention: they don't pay attention to detail, they have trouble sustaining their attention on a task, they might start reading something and not know what it is when they get done to the end of the sentence, they can't follow directions, they hear the first part but don't attend to the last part of the direction, everything seems important, they don't know how to organize or prioritize, having difficulty maintaining attention, but then they avoid anything that does require sustained mental effort. It's very often that they might lose things that are necessary. They don't have their notebook, they can't find their locker combination, they've lost their cell phone. Adults typically lose their keys, they misplace their notebook, computer, things like that that you would normally hang on to. They're very forgetful in daily activities, and you think to yourself, well, give them a planner. Well, they might lose that planner, so it becomes very difficult, and sometimes people make moralistic comments about the individual, like, what is wrong with you? Are you lazy? And people feel that they can control this when no one really wants to feel this way. Impulsive behaviors might include blurting out answers before questions have been finished, trouble waiting turn, interrupting others, and getting into people's body space, having tantrums and mood swings. So you can see just from these descriptors that some of these behaviors overlap with other things. So trying to sort out what it is can be quite challenging. Very careful assessment is needed. How do we help someone with ADHD? And I have to say there are a lot of behavioral things that we must do to help the individual. First of all, having a very structured and organized classroom environment is important. Having a routine, having things in place, easy to find, making sure that we have a system of rewards to reinforce positive behavior. Make sure that the rules and rewards and consequences are very consistent from classroom to classroom. Having clear directions and maybe even putting them on the board so someone can refer to them. Seating should be up in the front of the classrooms to minimize distractions. Maybe this is a person that would qualify for extra test time so that they can read the question, attend to the detail, and take that time and not feel that they have to rush through it. Modifying homework. Maybe this is a person that needs fewer outside homework assignments, maybe breaking them down into smaller pieces. I think it's important to ask that person, what do you think will help you better? You know, sometimes that individual knows themselves the best and can give you feedback. Again, I said this already, but careful assessment and diagnosis. If you printed these slides off, please underline that. I can't emphasize it enough, because our diagnosis guides our treatment. Behavioral therapy is critical, like breaking our tasks down into little pieces. Teaching self-control strategies. So when I get elevated, then what can I do? I can remove myself from the situation. I can practice some breathing techniques. I might listen to some music, take a walk after school. There's a lot of things that can be done to channel the energy into an appropriate manner. Restructuring the environment by making it more organized, less stimulating. Giving the student opportunities to respond and for praise and to actively participate, and structure. I really like positive reinforcement. Catch me doing something right. Helping them with therapy. Maybe this has really impacted their self-esteem and created some emotional concerns. Medications are also used to help the individual focus, work, and learn. 70% of individuals respond to medications. Now, I won't say that this is the end-all and beat-all, but certainly it's very, very helpful for many people. And it takes time to find out which medication and at what dosage could be helpful. I liken this to tuning something in. It's not going to help the student, get all straight A's, but it's going to help the student have a level playing field so that they can focus and concentrate and use their intellectual abilities to achieve at their best ability. Of course, medications have side effects, and so one would want to try to find the best medicine strategy with the least amount of side effects. In general, I would like you to remember that children are more different than alike. We need to classify symptoms. The classification of symptoms really doesn't help us with educational planning. So what we want to do is have that continuum of services available so we can tailor the educational experience to what that individual needs. I also would like you to remember that functioning for the person might actually depend on how severe the disability is. Is it chronic, ongoing? How many areas does it affect of their life and of their body functioning? When did they begin to have the disability? Did it happen at birth, or did it happen as a result of an accident? Those factors are very important as to how we address the needs. Is there a therapy that's needed for the child that's acquired the illness or impairment? Also, visibility. Sometimes the more visible the impairment may cause other people to underestimate the child's abilities and limit opportunities, so attitudinal barriers can come into play if things are visible. Now, I've given you a really cool CNN video about facial deformity, and so I'd like you to take a peek at that when you have a chance, and that talks about visibility. Overall, we want to look at a collaborative approach to help this individual. So you might need occupational therapy. Perhaps they need some help with small muscle control, such as feeding themselves or zipping up their coat. Physical therapy, they might need help with large muscles, such as walking or, running, transferring. They may need speech therapy for articulating their words. Or maybe we need a speech therapist to do a swallowing study to see what kind of liquids can we swallow without aspirating. So many times a doctor might order a swallowing study, and a speech therapist does that. We might need the school nurse involved. They might give us guidance on how to manage a catheter, how to administer medications, or what to do if the child has a diabetic, issue. We might need help with physical education. How do we adapt physical education? Maybe we need a counselor involved or a medical social worker. The classroom may need modification, maybe a wheelchair accessible classroom, and we might need assistive technology, maybe computer technology that would help someone dictate into a computer versus typing. I think it's so important that we look at inclusion, look at, attitudinal barriers and how to break those down. There are many current issues and future trends that we need to examine. Again, accommodations and related services in the classroom. New and emerging technologies, it's amazing. Bionic limbs, robotics. If you look here, here's a person who's lost 3 limbs. Cameron Clapp, I've got his story there if you want to click on it. The technology in prosthetics. Technology in computer-assisted movement is amazing. Wheelchairs that can climb stairs, We're in a technology revolution here, and people with disabilities can take advantage of all of these things. Animal assistants like canine helpers, dog helpers, there's even monkey helpers. I've given you a video on Blackboard for you to take a look at. Little monkeys that can help someone open a can of pop, retrieve something, pick up a pen, turn on lights, so on and so forth. We want to also look at employment and life skills and advocacy for oneself. We have to expand opportunities for people with disabilities to be employed fairly.